name is Gillian Garza, and this is my presentation on the novel coronavirus and the effects on older adults during a pandemic. So what is the novel coronavirus? The novel coronavirus is otherwise known as COVID-19, and it is a new strain of a respiratory disease. It is also zoonotic, which means it is transmitted between animals and people. COVID-19 was first detected in a fish market located in Wuhan City, China, and continues to expand today. How does it spread person to person? It spreads usually within about 6 feet of close contact with other people. It is also spread between respiratory droplets, which are infected between coughs and sneezes. And these droplets can land in the mouths or noses of people who are nearby or possibly inhaled into the lungs. Some of these symptoms may appear between 2 to 14 days after exposure, which include coughs, fever, pneumonia, runny nose, sore throat, fatigue, sneezing, and asthma. Some prevention measures that can be taken would be avoiding close contact with people who are sick, avoiding touching your eyes, nose, and your mouth, staying home when you are sick, covering your coughs or sneezes with a tissue, then disposing of the tissue, cleaning and disinfecting frequently touched objects and surfaces using a regular household cleaning spray or wipe, washing your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, after blowing your nose, coughing, or sneezing. My research questions are, what are older people feeling? How are they coping with the pandemic? And how does it feel like to stay home for the past 6 months? And I took consideration my great-grandparents because they've been home for the past 8 months, social distancing. As for my methodology, I will have to observe patients on their mental health as well as surveying a random selection of people on their older family members. And as I survey people, I remember to keep the confidentiality at its highest priority. Family members will also continue to monitor their older adults and answer a survey. And then I will gather my information and come to my conclusions. As for my acknowledgements, I would like to thank Dr. Garza, Mrs. Agüero, Mrs. Solis, Dr. Lopez, and Sonia Ortiz for this amazing opportunity to study COVID-19. As for my references, I use these 6 to outline my literature review as well as this presentation. Thank you.